Hi, I'm Marybeth Van Horn and welcome to Nurse Chats. Oh gosh, I'm making lots of videos today based on a lot of emails that I've been receiving and issues that have been coming up, but today's Nurse Chat is about injuries. And oh my goodness, I have had plenty of injuries. Holy cow. Is it my luck? Is it the way I live? Am I a risk taker? Probably all of above. I think I've mentioned before on Nurse Chats that I had the misfortune of stepping onto black ice in February in Colorado on a very sunny day back in 2015. And as Coloradans know, and many people across the country do know, that we can have a freeze through the night in the spring and snows during the week, and then have a very, very nice sunny day, and everything seems hunky-dory, except the ground still has frozen patches and ice. And year after year, during this time of year, in the springtime when there's been snows and ice, we hear the stories of people who were fine one minute, the next minute they stepped on ice, and the rest is history. In my case, I stepped on black ice, which is the definition of black ice is that you can't see the ice. So I stepped on black ice. As soon as I stepped on it, my foot torqued in such a manner that my right femur snapped in the air. It's the largest bone in your body, snapped in the air. When it snapped, I fell to the ground, and I know I'm recapping the story, but maybe most of you probably already know from me mentioning it before, but then I broke my wrist. So what I want to say about injuries is a few things. Recovery takes time. I think I was coached numerous times about don't look too far ahead when you're recovering from an injury. That's danger zone because it can lead to depression, it can lead to giving up, it can lead to a lot of things that don't serve you. So it takes time to recover, and one of my surgeons said it best when he said, Marybeth, stop looking ahead, stop going way in the future. When am I going to be done? When am I going to be, when is this going to go away? When am I going to, and he said, take one day at a time, literally one day at a time during your recovery. And every single day, notice what you did better that day than you did the day before. Find the one thing that was better that day than the day before. And that was sound advice. I'll tell you what, I took that advice because it got me into trouble when I went too far in advance trying to speed up recovery. You can't really speed up recovery. You think you can try, but you're going to be sorry if you can't, if you don't listen to me. You're going to take time to recover. And if you don't, you're going to have a consequence. When I was a camp nurse, believe it or not, up in the mountains of Colorado. And I can't tell you how many counselors, these are young people, who would heal quickly, but they twisted their ankle. And if we all know that when you get a twisted ankle, sprains take longer sometimes to get better than breaks, right? So the swelling would be extraordinary. We'd have to put them on ice, elevate. Try not to weight bear. Well, these counselors, wanted to speed up recovery. They wanted to get over the process. They didn't want to do what they were supposed to do. So because of that, their injury was prolonged. They were plagued with problems from that tissue that really, really was being aggravated frequently for a long time, okay? In my case, I had to ice and elevate, and I had to sit and be patient with that several times a day. That was probably the hardest part. The pain is terrible, the muscle spasms, all of it, the wound, but waiting for recovery and sitting on ice was probably the hardest thing for me because it took so much patience. And next tip, I would say, do what your physical therapist tells you to do. because we think, again, that we can outsmart our doctors and our physical therapists and our people and our occupational therapists because we know better. Well, they know better. So if they tell you to do something and they're asking you to do an exercise at home, if you don't do it, guess what? You're going to have a consequence. Good, bad, indifferent. You're going to have a consequence. I'm not going to say any more about that. I had a torn rotator cuff at one time. I had a steering wheel that I went on ice again with a vehicle and went off the road onto a gravel side of the road, and my steering wheel whipped. So I had a torn rotator cuff, and I had to have that repaired surgically. But during my rehab, I had to endure the pain that it took to get the range of motion I needed. And so my physical therapist said, you have to allow us to move into that pain. You have to accept pain. Pain is not, in and of itself, pain is not lethal. And that took me a little bit of mind change, because that was one of my first injuries that I had ever had. It was the first time I ever went to physical therapy, to tell you the truth. And I was unfamiliar with physical therapy. When he first started torquing my arm to where, I called it torquing, but exercising my arm into range of motion, I screamed. I was like, oh my God, what are you doing to me? I was very angry. And I've seen it over and over. I've been in a lot of physical therapy because of my injuries. Oh my gosh, my leg injury alone. I went to physical therapy 4 times a week for almost a year. So I'm walking today because of those physical therapists. But the physical therapists put up with that because they know that you're going to go through a period of time where you're defeated, you're tired of it, you're angry at them because it must be their fault, and it goes on. But I remember that I literally was mad at my physical therapist at first, and then they explained to me again that pain is not lethal, that they're not trying to hurt me, they're not my enemy, they're in my corner, and that I had to, if I didn't adhere to what they were trying to do or help get range of motion from my shoulder, that it could happen that I'd get a frozen shoulder and I might have to have surgery again. That did not sit well. So from then on, I was like, okay, what do I need to do? Tell me what I need to do. And I did the same with my leg. I was a little bit better with the leg because I understood what I had learned from the shoulder. However, when my hand was in a cast and the cast was removed from my broken wrist, I ended up having a severe nerve problem, and it was called, another thing that developed was called inflammatory fibrosis from trauma, reactive inflammatory fibrosis. So the pain was extraordinary. So dealing with the hand therapist was quite a different experience for me. The pain was extraordinary. But enduring pain, I learned how to, different techniques for myself, how to endure pain that I knew was necessary to get through rehab. And injuries require some sort of rehab, no matter what they are. I had a knee replacement. So again, I've had a number of things over the years, and I had a knee replacement, and I remember that I was going to walk. I was going to show everybody that I could walk without assistance, and by golly, I don't need a cane, and I don't need this, and and I remember one day limping into a meeting, and a friend of mine who was a occupational therapist said, and it was, friends can be mentors. They don't always, sometimes a friend will tell you something that's not pleasant to hear, but it's because they love you. And my friend said to me, Marybeth, there is no merit in limping. You may think that you're strong and you're showing everybody that you can walk without assistance, and she was absolutely correct. There is no merit in limping. So limping for pride's sake doesn't get you anywhere. So again, you can affect your hip by limping. You affect your back. There's a lot of reasons that you don't want to just limp because you think you're strong and you're going to show everybody. I'm not talking about people who have some limp that they're not going to ever be able to get rid of, and I assume they use their assistive devices, but they're still limping. That's different. But mine was being bullheaded. And so I was going to walk without assistance because I was young when I had my first knee replacement. I was like, I don't need a cane. Are you kidding me? Yes, I did. Yes, I did. And when I finally took direction and became humble, I actually did better. Icing. I'm not going to sit. I'm not going to sit now. Icing's important. And using the bands or whatever you're doing for physical therapy is so important. Please, please, please listen to your physical therapists. Do as they say. Make sure that you do what your doctor says. Nurses, we can give advice all day long, but it's up to the person to take the advice. So that's all I'm going to say about injuries. But if you have more questions about injuries, if you're going through rehab right now, or you have issues that you want to ask me a question about, I've been through so many things I just told you. I have quite a lot of personal experience. So how often do you get to just sit down and chat with a nurse and ask the questions you want to ask? So do it. This is your nurse telling you. Okay, see you next time.